Basically, we are as a business association, we deal with issues to do with moving items, product from whether by road, by sea, by air, by land. A country like South Sudan, because we don't have a sea, we are a landlocked country. So we are depending on the port of Mombasa or Port Sudan, but because of the north side of our country is blocked, we are getting most of our imports coming from the port of Mombasa or exporting through the port of Mombasa. Initially, after the independence of our country, well, most of our business activities in South Sudan were facing a lot of challenges. Delay, one of the reasons is time. The second issue was the cost of doing business or transporting cargo. And then the issues of NTBs, which is happening, non-tariff barriers along the roads. So the necessity has come for us to form this association through our partners in the region, like we have the Uganda Shippers Council, Kenya Shippers Council, and that gave birth to the South Sudan Shippers Council. We are part and parcel of the South Sudan National Chamber of Commerce. Our Shippers Council objective, you can go online, you find them, that we have online. We are a business member association, 2013 initiated and 2015 registered in the country. We advocate for issues to do with policy. We deal with the Ministry of Trade, Ministry of Finance, East African Affairs, and other ministries. We are a platform to discuss our issues of integration to the East African community and also integration to the World Trade Organization. And I've been playing a role with the members to do things. The main objective is two things only: to make sure that we get things on time and at affordable rate, cost effective. And now, next slide. What happened in the industry is shocking. From the 1990s going all the way to 2019, we have seen this change in the global industry. People start talking about globalization. The world become a small village. The division of labor has been broken into countries. Manufacturing also have done the same. And you have a country like United States, which is producing apple, but at the end of the day, that compound of those apples are producing almost about 40 countries. So it means in order for you to get that single phone, you have to depend on about 40 countries. Now, if we say that, how can we move those compounds? It requires logistic. Next slide, please. It requires logistic. So yeah, once logistic is there, then we can be able to move the component. Also, we can be able to move the information. Also, we can be able to move the material. So on my presentation, I'm only going to focus on three things. First, I'm going to focus on the impact of coronavirus and what happened. Next, I'm going to work on the response. How did the world react to it? So it's only about two simple things. On the next slide, after about us, we have, I'm going to have my slide here while the other one is coming. I talk about COVID. So what happened? COVID happened in China, and the immediate effect has been realized all over the world. Why? Because of the way China is playing in the industry or in manufacturing. Most of whatever we have, table, computers, somehow there's a component made in China. If you look around yourself now, a lot of what we have is made in China. And Johann, the city itself, it play a big role in the industry in China. So that effect that happened there, when this happened immediately, what we have realized that there is a disruption in the manufacturing industry. So people are not getting the compound for the process. And then what happened next? There is restriction. Okay, the government of China makes sure that, okay, we don't want this virus to go all over the places in China, even to the world. What happened? There is restriction, lockdown. People cannot move. And for sure, if you don't move, what are we going to do? Nothing happened. So people were really eager to get what they can to store in their homes, because then they don't run into shortage. And this is what happened in the United States and Europe. Even you can find toilet papers are not available, because now the manufacturing could not meet the demand. Also, when there is lockdown, the number of employees coming to work will reduce. Now what happened? We have social distancing also happened. Next week, there's shortage of compound for industry, including medicine. Now medicine, if you look at the medicine, how the medicine come, there is a medicine itself, there is the container that carry the medicine, there is the box that they put the medicine. So if the boxes are not there, how are you going to carry your medicine? So this interruption in the industry have really come because of coronavirus. And for us, as Shippers Council, as people who are speaking on behalf of the cargo owners or transporter. As a landlocked country, what happened to us is only two things. Our land freight has been disrupted. From Mombasa to Juba, we have not noticed there is delay between the months of April to June. Because why? Because of the checkup, medical checkup, or the corona checkup. So now there is delays on this process. People do not know how to certify these people, how to control the drivers moving, because the driver will be accused that the more people who are transmitting the disease. So now there's a lot of hassle happening in that area. And then you find that land freight logistics, there is a lot of chaos happening because it is something that surprised the whole world and surprised us in the industry. But as time goes by, our industry, when it comes to transport, came back to the shape. And now we have a technology came in to improve the logistic industry, whereby we can track the drivers, we can track who are positive, who are negative. We have digital certification that is made through app application that can be downloaded to our driver phone, and it can be checked in the border of Malaba, at the same time in the border of Numule. So there's a lot of improvement. And then what happened after that, we have also the issue with airline freight. Because we are not going to asset in the beginning, we have seen a lot of passenger planes have stopped operating, and the cost of transport is also become high. Why? Because the capacity become low. And now what happened? A lot of airlines also, they have changed dimension because they have to keep with the economy. They have to survive. So the survival way was they started removing the chairs of the aircraft and use it for cargo. And one of the airlines has not stopped during the operation is the Ethiopian airline. We thank them for that. It has been operating all over the world, and cargo was one of it. And then followed by Kenya Airways, they start also bringing cargo. And then also we have a passenger place, but in emergency cases for maybe Canadian country who want to evacuate their people, American, British want to evacuate on a scheduled time. So this is what happened in the industry, and that has changed. And also a country like Rwanda, they start using also the robotic to move medicine from place to place. They call it the drone. And it is an object whereby really it's helpful for emergency to take maybe an item from Juba here to Konyo Konyo. You don't have to drive, you go with the drone and the drone will arrive. That very crucial small item or maybe medicine that can be saving life. And basically this is what happened in the industry. Our response, what happened? How the country respond? How did the government respond? How the business respond? When we talk about business, we deal with human. And when we're dealing with human, we need to save life. So in our industry, we responded by making sure that company introduced protocol, social distancing was introduced, disinfection of people have been introduced, wearing gloves and wearing protection gears. And then also we make sure that the oldest one, because most of the people affected in the society are the senior or the oldest. We make sure that they are being given paid leave in order for them to sustain. We don't let them off totally. We give them time to stay home. We pay them until they come back. And this is one of the measures we have used with the government, and we reduce the number of employees too. And that, of course, is going to affect the total production. But we have done that to make sure that humans survive. Another also means people are looking for alternatives. People are now looking for home delivery. Instead of going to the shop, you can, from home, you can go online, which is e-commerce have been introduced widely. You order your things online and you track them until they arrive to your door. Beautiful things. And these are the things that a lot of industries are encouraging during the training for innovation, better way to do things. Lastly, we have the support for technology, whereby we have been getting the supplies for protection gears and equipment that can be used to detect the coronavirus. And also we have, as I said in the beginning, that we have the REDAX, which is the regional electronic tracking system has been introduced. All this has helped us as in industry to move forward with the logistic. And as we say, logistic is delivering things to the people in need. And we make sure that the end user get what they want.
So I would like to begin with this perspective. With COVID or no COVID, we are family. We are neighbors. We are together. We remain as brothers and sisters. So COVID, in one way or the other, cannot separate us. What's needed is how can we, put effort together to really fight the pandemic. And then it has also proved to us that not one family, not one country can really, do away with COVID. But it needs collective effort. It needs, contribution from everyone to really deal with the pandemic. And that's why at the regional perspective, at the EAC, developing more closer cooperation is very, very paramount during this kind of pandemic. I won't take much time on this slide. It's basically, giving some historical perspective of what EAC is. We all know that it is intergovernmental organization, comprising of 6 member country states, including South Sudan. But one interesting fact that I would like to tell you about the bloc is it's a home to up to 177 million citizens with a GDP of about 193 billion US dollar. So these, in a nutshell, present a wonderful investment opportunity in the region for each and every member state within the East African Community Affairs. So what I would like to explain briefly about the East African Community, which I believe summarizes what the integration stands for, is about these 4 pillars, the 4 pillars of the integration. We also need to bear in mind that these 4 pillars of integration, was developed, in very akin to the integration of the European Union. And that's why European Union has always been much in support, like supporting even South Sudan now in the process of implementation of this regional framework. Not only in the implementation, but even at the stage of accession. EU was with the South Sudan, during the negotiation until South Sudan was admitted. And then they are still also with the South Sudan in the implementation process. One key pillar, which is basically the first, pillar at the time of the establishment of the treaty, is the custom union. So the custom union basically looks at how the 6 partner states of the East African Community, can have free trade within the region, a total free trade without any barriers, without any restriction, but establish a common external tariff on any goods coming outside the region. The second one is the common market. The common market entails free movement of goods, free movement of people, free movement of labor, free movement of services, free movement of capital, and then the right also to establishment, in the sense that you have the freedom to establish yourself, establish business in any of these 6 partner states without any conditions, without any restriction, and you receive a treatment as the same as the citizens in that particular country is receiving. You shouldn't be, facing any form of discrimination. The third one is the monetary union. This is basically looking at having single currency for daily transaction across the East African partner state. The last one is the political federation. So in a nutshell, political federation is looking at the end, how can the region have a kind of a united East Africa, politically, like a kind of one federation, a kind of, a political authority government, in a very united. That's what they last. Although it's a very, very, it's a very, very ambition one. But that's where we are looking. The region is really moving towards having such kind of a united, East Africa, politically. Well, this administrative guideline was developed as a part of response to this pandemic. So to really ensure that with the pandemic, business should not be affected so much. Cross-border trade should not be affected so much. So in that sense, it was then developed to regulate how we can continue be doing cross-border trading, but putting in mind that we follow all the precautions that's required to mitigate the spread of the pandemic. So one key objective of the the guidelines is to ensure smooth and uninterrupted movement of goods and services during the pandemic. The other main part of it is to mitigate the negative impact of COVID-19 on movement of goods and services. So although we have this pandemic, but let the flow of goods continue, let the flow of services continue, let the business between countries within the region, let it continue. And also to help in raising awareness about the pandemic, against the pandemic at this critical time. That's the main reason why most of these administrative guidelines was really developed. So one relevant element of the guidelines, which is quite relevant to the logistician, is that the guidelines is looking at a way that the cargo handling at the port have to continue in the same manner as before COVID, that it should be handled by a multi-agency, because they are all relevant. They all play different role within when it comes to clearing cargo at the border points. But what's more important is all this has to be done while it take while the time which is taken to really clear a track should be minimized. We don't need to spend much of the time on clearing. We have to do it as quickly as possible. And then the other thing is that at the point of doing it, we really need to ensure that we adhere to and provide health and hygiene facilities as per the WHO recommendation and the national even measures to contain the pandemic. This implies, we have to follow all the procedures, the washing of hands, periodic sanitize the hands, face mask, and all other measures that are really, including social distancing. We have to, handle all these. We have to follow and adhere to all these at the, border point. The guideline also focuses on a priority treatment for cargo, which are, important in mitigating the impact of COVID-19. For example, in our context now, we are looking at if a cargo is, let's say, is carrying, let's say, medical products. So such kind of cargo, has to be accorded the periodic treatment in the sense that it should not be delayed at the border point. It's very, very important that it is cleared earlier so that, the delivery reach the patients, the consumers at the right time. For example, another product will be, maybe food stuff, it should be very, very important that that kind of trucks should not be delayed at the border point, including relief product. So that's why the community is really making, develop this kind of a guideline to ensure that such kind of essential products and essential services should not be delayed, because it's in one way, contributing to fighting the pandemic. And then another element of these guidelines is that in case if one country discover a certain product which is quite helpful in fighting the pandemic, and if that product is in a certain country within the regional bloc, it's very, very necessary that the country in need can contact the other country so that it should be accorded to priority treatment. You talked about this regional electronic cargo drivers tracking system. I will say something briefly about it, but first of all, what is it? It's nothing much. It's just a mobile, app. An app. It's a web-based system that provides trusted information. The most important element of it is it's an infrastructure developed to ensure that information can easily be shared with regards to the pandemic with the member states within the East African community. Why is it at this particular time? So it was indeed developed to really avoid delays currently being witnessed in key border points. Yeah? So another main point of it is apart from minimizing delays, is to really monitor to ascertain to what extent the truck drivers are able to comply with the COVID-19 measures. And then it's also very, very important in the sense that it minimizes exchange of physical documents, because it's a web-based kind of thing. It's electronically. There is not much need to exchange paperwork that in one way poses another risk of. One thing here, the first thing here is you as essential service provider or a truck driver, you have to register. You have to register. And then once you register, the authority will or the agency will approve your registration. And then once it is approved, your COVID test result will be uploaded to the system. Your COVID test result will be uploaded to the system. And then once it is uploaded to the system, it's then linked to your driver's account and the trip. Once it is also linked to your driver's account, the details can be easily retrieved by an authorized person by scanning the QR codes on the driver's application. So this is very important in the sense of what Yoa was also talking about, that one truck driver, for example, if a truck driver is coming from Kenya, is tested in Kenya and reaching the border point of South Sudan, need to be tested again, despite the fact that they tested negative in Kenya. But now it's very, very easy that if you are already tested in Kenya and then your result is uploaded to the system, there will be no much need again for you to be tested at the border point when you enter South Sudan, and the vice versa. It also helps in the sense that, when the pandemic started, there were a lot of issues also being recorded in terms of falsification, try to forging, COVID-19 certificates. All these practices were already happening among truck drivers. But this kind of web-based system, is really helpful in the sense that it really minimizes that. It's not you speaking about you got tested, but it will be the system now speaking to the authority that you are tested, and here is the evidence. Your certificate was already uploaded to the system, and it is accessible.
Before I go into the micros of my presentation, just allow me to take the forum through some of the factors, the scenarios that brought about, creation of the UN COVID-19 supply chain system. I think it's a common knowledge globally that this pandemic brought about drastic and acute shortage of essential commodities. Case in point, PPE, biomedical equipment, and diagnostics. It was basically through the request of the UN General Secretary, who came up with a task force that was mandated to come up with this UN COVID-19 supply chain system that is being engined by the COVID-19 supply portal. In order to ensure far and wide rollout of this COVID-19 supply chain system, the UN office under the Resident Coordinator's Office was compelled to lead the implementation of this at country level. In South Sudan, I was appointed to lead the implementation of this as the supply coordinator for all the UN agencies. The COVID-19 supply chain system is basically underpinned by three main principles. I will discuss them in depth in my subsequent narration of the presentation. At a country level, we basically swung into action swiftly when this UN COVID-19 system was launched. So we had to adhere to all the mandates of the country as an important element of the UN COVID-19 supply chain system. We had to come up with country demands, estimate our requirements in terms of essential commodities by reaching out to key pillars, ensuring inter-pillar coordination. Best bit, there was enabling environment, courtesy of WHO. There was an epidemiological simulation tool that was designed especially to guide countries in defining commodities or requirements for essential commodities. These were basically tools that were required to be, populated with key data, quantitative data, for example, cumulative cases in the country, number of health facilities functioning in the country, number of HR personnel working at the laboratories across the country. So it involved a wide interaction and consultation with head of pillars, especially the case management and laboratory. So we were able to take profit of some of these tools, which were, designed by WHO to basically have a clear visibility of the country demands at the, at the country level and at the subnational level. So the COVID-19 supply chain system, as I indicated earlier, at the request of the UN Secretary General, it was created. And that led to the creation of a task force. And the task force were basically mandated to come up with a strategic or a vision for this supply chain system. So before you is just an overview, an architecture of this COVID-19 supply chain system. And as at the top of the apex was the task force, and their major mandate was to provide the strategic direction of the COVID-19 supply chain system by bringing together like-minded organizations with the same visions to basically come up with a strategy, a document, a way of ensuring that this is implemented and sustained in the entirety of the pandemic. The mid of the triangle is the purchasing consortium. This was also formed courtesy of this task force. The purchasing consortium was a composition of like-minded organizations, case in point, WHO, UNICEF, UNDP, Global Fund. And the primary mandate was to ensure that partners, according to their comparative advantages, are allocated specific roles in terms of procurement of essential commodities. Based on their comparative advantages, these organizations took the role of being the purchasing consortium for specific supplies. For example, WHO was the main purchasing agency for PPEs. Global Fund was the main purchaser for gene expert cartridges and other automated kits. UNICEF, on the other hand, was a purchasing consortium for other diagnostic tools, and WHO was also the purchasing consortium for biomedical equipment. At the bottom of the pyramid is the control tower. Control tower was like the interface, the bloodstream of this system, making sure that the purchasing consortium are directly linked with the manufacturers, with the suppliers. The purchasing consortiums are directly linked and coordinating well with the agency running logistic and distribution globally. And the first line link with the country, the requesters, making sure that orders that are transmitted through the portal undergo all the prerequisites, for example, indicating the funding source, making sure the commodities available in the market are communicated to the requesters. This COVID-19 supply chain system was underpinned by 3 key principles. And as you can see before you, the key 3 principles were very, very integral in making sure that this system is implemented far and wide through coordination among the key players. As the first one was consolidation of the demand. At a country level, our role was making sure that we have a clear visibility of our demands for 3 to 6 months, making sure that partners, especially pillar leads, coordinate in defining or quantifying and estimating the requirements in good time. Second important role for us was making sure prior to uploading of any request onto the supply portal, partners were urged to gather or lobby for funding, because any order transmitted through the supply portal must be underpinned with a funding source. It was important to make sure that at least at a country level this is realized. Another important role was to validate any request transmitted through the portal, and any partner in active response in the country is eligible to sign up onto the supply portal and to upload a request onto the supply portal, keeping in mind that funding source is declared. So my role as the supply coordinator was to validate any request uploaded onto the portal, either from WHO, UNICEF, WFP, any organization within the country. And there was a criteria of making sure that approvals follow the requirements. So there were 2 ways. I was basically validating or rejecting requests, and any orders without clear details, any orders without a clear source of funding was basically in the brink of rejection, or instructing the requester to provide the necessary documents. The second element of the supply portal was the second principle, rather, is the coordination of purchasing, as I indicated earlier. It was important that the purchasing consortium basically work together, speak with one voice, ensure that they meet the market with the same strategy, thereby creating a wide network of manufacturers, suppliers, creating long-term agreements with potential manufacturers and suppliers in order to mitigate against stockout in the system. You are aware we are in a demand-driven supply chain, so it was important that the control tower furnishes the purchasing consortium with needs of each country. The other underpinning principle was streamlined distribution. In order to ensure active and timely delivery of commodities into the requesting country, the global WFP came up with consolidation hubs. So these strategic hubs were distributed across the globe. In Africa, there was a consolidation hub in Ethiopia, Addis Ababa, Accra, Ghana, and Johannesburg. There was another consolidation hub in Guangzhou, China. There was one in Panama, and the last one was in Belgium. This was basically purposed to ensure that goods within the regions are consolidated in time, and their schedules for delivery also facilitated through real-time information sharing with the requesters and the control tower. Next slide, Carolina. We basically came up with the process of, or rather the procurement process, and as I indicated earlier, at the country level, our main role was to upload our demands onto the portal and declare the funding source. Then making sure that the demands align with the country PPE requirements. Once these data are transmitted onto the portal, it was basically subjected to a range of approvals at the country level, validations once all the prerequisites functions or other needs are adhered to. Once upon approval at the country level, these requests are presented to the control tower. The control tower, their main role was to double check the funding source, the nature of commodities before transmitting to the purchasing consortium for eventual procurement. Upon confirming availability of these supplies in the market, the purchasing consortium directs feedback to the control tower, thereby notifying the requester of what has been availed in the market, what has been sourced in the market against the orders. Once the requester confirms or rather agrees upon the availability or what has been sourced in the market, a pro forma invoice is therefore issued to the requester for signing. And once a pro forma invoice is signed, the control tower touches base with the purchasing consortium and the agency, the global logistics, to basically process distribution and logistic at the country level. So as you can see, the 6 steps were very, very key, and information flow was very, very integral and far-reaching coordination. Just to give you an overview, or rather the architecture of the supply portal, as I indicated, this was like the engine of the COVID-19 supply chain system. So it basically composed of other tools that were very, very important in informing the potential requesters what is available, the estimated price, the category of what could be ordered through the portal. So before you is just an overview of the COVID-19 catalog. This catalog, we update it on a regular basis based on the availability of commodities and alongside their prices in the market. As you can see, it clearly indicates or rather describe the commodities in depth. There's a special code, assigned to each commodity, indicative prices, and even unit of measurements. So we have been updating this and circulating it widely to potential requesters. And it is important before transmitting a request onto the portal, and even for budgeting purposes, it is key to basically interact with the catalog in order to have a clear visibility of the price ranges and the amount of equipment that could be ordered through the COVID-19 supply chain system. Before, it's just a supply chain process flow that was designed to educate or to smoothen the process of ordering, to ensure wide awareness of the process. This basically helped in tracking commodities, tracking status of procurement, tracking status of orders, having a clear understanding of who are responsible to which activities. At the extreme left are basically the key entities and their key functions. Number one is the requesting organization. These are basically the roles and the responsibilities of potential requesters at a country level. As I indicated, it was our key mandate to ensure that at least we have a quantification and a forecast for 3 months, and confirmation of funding and submitting request onto the portal. Yeah, and the last task of a requester is making sure that these commodities are received and touching base with the distributing and logistic agency to facilitate and coordinate delivery at the port of entry. Another entity of the supply chain system was the national authorities. This was basically to ensure coordination, to ensure inter-pillar coordination, to forestall any sort of duplication and overlapping, agreeing on a requesting organization in order to have common understanding, to like the common voice in terms of making orders in the country. The other entity was the supply coordinator, and that was my major role, validating all submissions, making sure that they align well with the requirements, funding source being declared, quantities resonating with the country demands, making sure that the contact details are captured, like the consignee details, the name and the email address of the supply focal person of that particular organization. In the likely event that some data are missing, I always touch base with the requesters to make amendments before rejections. Rejections could potentially be reached if partners have not declared funding source, or fundings have not been secured at the country level. The fourth entity is the control tower. As I indicated, the control tower is the interface, the bloodstream of this system, interfacing being the interface between the requester and the purchasing consortium, being the entity between the purchasing consortium and the transport and distribution agency, and being the interface between the requester and the purchasing consortium. The second last was the procuring agency. As I indicated, it was a makeup of like-minded organizations with their special comparative advantages. Like I indicated earlier, WHO was in charge of procurement of PPE. Global Fund, on the other hand, was in charge of procuring diagnostics, mainly automated kits like GeneXpert cartridges. WHO was in charge of procuring biomedical equipment. So by having such kind of an arrangement, it was important and timely to have the same strategy or vision when addressing the market, in terms of negotiating for prices, in terms of creating contracts, in terms of designing long-term agreement with potential manufacturers and suppliers in the market. And lastly was the World Food Program service provision. There was a global service that was fueled by funding from institutional donors. This was key in making sure that these commodities reach the port of entry in good time. So they played an integral role in steering the logistic and the distribution element of the supply chain system. So the next slide that you are about to see is a dashboard that we designed at the country level that captures all the key variables. So we were actually updating this and we do update it on a weekly basis. It captures the value of commodities that have been ordered through the portal since its inception in South Sudan. It also captures the number of requests, captures the name of organizations who have transmitted their demands onto the supply portal. It also captures the number of donors who have supported or funded orders transmitted through the portal. It also gives an overview of the type of commodities in terms of percentage. It also gives an overview of the number of orders validated and rejected in the portal. So Carolina will share, or rather circulate through this presentation, and I'll be very, very happy to address any questions bilaterally related to COVID-19 supply chain system. Yeah, so I think I'll also take the opportunity just to take you through some of the best lessons learned, some of the challenges, and how we managed to mitigate against some of these challenges when they showed up in the country. One of the best lesson learned, I would say this was phenomenal. It was a groundbreaking initiative, not only at the country level, but at the global level. Forming a COVID-19 supply chain system was really necessary, given the drastic and acute shortage of essential commodities globally. It was a way of leveraging on comparative advantages and basically promoting coordination, leadership, and collaboration globally and in country. Through the COVID-19 supply chain system and its principles, we are also able to ensure that at the country level, we also encourage coordination and cooperation. Case in point, we have a clear supply chain system in the country. We have a common pool of PPE in the country being stored at the logistic cluster. We have a system of transmitting PPE requests in the country. We have one UN email address through which requests on PPE are transmitted. Through these, we were able to come up with standard operating procedures that governs allocation of PPE using the prioritization criteria that we designed. There's a committee that was formed to audit or assess all requests transmitted onto the common pool in the country to help in prioritizing an allocation of PPE in the country. So I will say it was a groundbreaking, and we tried at the country level to borrow the same, and it has really realized fruits. Of course, with all these achievements, challenges came up. One of the challenges, as I indicated, was uncertain lead times. As you know, the market, the pandemic dismembered those socioeconomic well-being of different environments at country level, at the global level. So at the very, very beginning of, or rather at the first stages of the pandemic, the market was strained. There was huge demand that amplified, it went through the roof. It was very, very difficult to meet this demand with the limited supplies in the market. Thanks to coordination, thanks to lifting of restrictions. So there are countries where manufacturing was heightened, like China. There are countries where borders were open, so we were able at least to take profit of this. So another restriction was basically when there were bans or rather borders closure. So this basically prolonged the process of delivery, especially movement by road. So all these delayed allocation of essential commodities in the country. However, we were able to mitigate against this, not in a large scale, in a small scale, by taking profit of the available supplies in the country, especially taking profit of the infrastructure established during EVD. We had limited stocks in the country that we could basically profit of, as we were basically expecting the commodities ordered through the supply portal.
Here we will talk about the pre-positioning, that how MSF doing its pre-positioning strategy in a different state, but especially in South Sudan. So my name is Omar, and I'm a mission supply chain manager in South Sudan. So MSF is basically a medical organization which is provide assistance to the people affected by conflict, epidemics, disasters. So the first response is the team, the health professional, logistics, and administrative staff. So they are the people in the front line to fight against those epidemics and disasters. So basically, MSF is providing and hiring the people on locally, which we can build the capacity, and then they can run the projects in their own countries. So basically, the actions and these are under the core pipelines, the core principles like impartiality, independent, and neutrality. We have no discrimination with race, gender, and anything. In South Sudan, basically that time when MSF started work in Sudan, it was Sudan. Now it's divided into pieces, so South Sudan and North. But in 1983, they started work. And in South Sudan, now we have 6 projects: Bentiu, Lankin, Piri, Unity, Lair, and Mundri. We are supporting the main hospitals in this area and also providing medical support. In this slide, you can see in the Lankin, which is every time we have issue with this area due to rain. Roads are, if you see from Juba, is the main Nile going to Lair, Unity, and this area. So we have issues in this part because you can't land. There is no proper airstrip in that areas. So if there is a rainfall, so it's affect on the entire activity. So in view of that, in the next slide, you will see that based on the weather condition, the organization and the team make a strategy. From November, the rainfall is start decreasing, it's reduce the volume. So in December, it's almost little start drying. In January, Feb, March, these are the months if we make proper arrangement for our pre-positioning and plan for our activities, what we required, what programs is Watson or medical or whatever. So what they required in the field, they can easily cover all those items, all those requirements in these months, starting from December to March. So this is the best way. If we see the weather condition and climates in January, Feb is the volume is too low, but it is increasing in March, April onward till October. So this is the best strategy anyone, any organization, and already you guys will also planning according to that. So it's better to work in a good planning, so that will help everybody. During the rainy season, this was it was only possible via air transport, which is very costly. In this graph, you will see that we request to UNHAS, and you will see that 5 requests, 2 successful and 3 unsuccessful. These unsuccessful is based, the cancellation based on the weather condition, where the plane left, but the weather was not clear, so they return, or sometimes they refuse. Our own caravans, MSF have like 2-3 caravans, and the total requests from the projects, we received 254, which from that 230 was successful and 24 was unsuccessful due to weather condition. One airdrop, which was in a highly emergency, we sent to cover some sort of medicines, but it was damaged because 10% was damaged because it was airdrop, and the land was not good. So due to some mud and these things, it was highly damaged. Other than that, some doniers and heli we requested, and it went successful. If we based on the statistic from the data, we got this information that aircraft that can take like 1 to 1.5 ton metric ton is almost, if we check and compare to the trucks, 20 metric ton trucks. So you can see like the cost per aircraft cost is 7,234, but the same, if we see in the same area, it's $8,000 per truck, which we can use like 20 metric ton. So it's a huge difference, and everybody knows that the air transport is very costly if you compare to the road and sea. So based on the cost analysis, if we check, we can just 90% save if we use a proper planning. Based on that planning, we can save like 90% of our resources for the organization. In this, you can easily see that our air operation is so high, and the road transportation is just like 200,000. So this is just a small summary of air transport, like 270 ton. If we use that total weight on road transport, we use the road transport for the same capacity, for the same weightage. It's just you can see easily that it's 90% of cost reduction. We can save a lot of resources. For better planning, like for this year, we request the programs that whatever they required, they just share with the team, the project, based on the communication channels. And to to gather this information, we start in November. So in November, we start the requirements. We send the request side, the supply team and technical logistics. They started the identification and sourcing the request and everything what we required. We send RFQs and selection of pre-qualification of suppliers. We start this process in October, November. So from that time, everything was ready. Just we have, when we receive the request from the program, we will just, the idea was that to avoid delays and these things, just pre-qualify the suppliers, and then we will immediately generate the orders and will process as soon as we get green light, and also the roads are clear, so we will start moving these items to the sites. So also there was some conditions in the pre-positioning. We put some main points that the shelf life should be longer, because it's necessary if it's with the less and with a short expiry, so that is not effectively work in this situation. So the potential suppliers was identified. Order was like once we receive in December, so we will start moving. Lead time was good in case of we are going for blanket orders. So because the suppliers, main suppliers in Juba, they are dependent on Kenya, Uganda, in these areas. So we have to put and keep this in mind, that we have a good lead time. So all these things was done, and after that, this time we got a very good result in this one, in this strategy. And in advantages, you will see that based on the calculation, what we saw in the previous slides, that we can save 90% of budget from road transport compared to air. We can even deliver machinery like incinerators, construction material, because there is a lot of requirement for construction of infrastructures, and also the new rooms or whatever you require there. So you can easily take that one to in a nominal cost to and on time, because on those project sites you can't get these construction materials and these items. So Juba is the one from where we have to transport these things. So then also when you have all these items in a proper way, you can easily make your stock management, your that what you have like a better and stock management system. You will be aware that what we required based on your monthly and your whatever consumption, AMC average consumption. So this is a good one. So this basically, this strategy will help everybody, and to avoid delays in the emergency situation. Because whenever in my previous experience, the projects, they just if they don't have a proper plan, so they just send request to logistics, oh, we need this one by tomorrow. So it's they are creating like emergency. So with different organization, like the scenario is different, but for logistics, they create just emergency situation. To avoid that situation, that is the best way to make a proper plan, and based on that plan, you just make your target market, assess your target market, identify your suppliers, and then whenever you receive the order, just place the order, and during the time limit, you can easily get and the accurate quantity or whatever you required. So at the end, I will just say that plans are nothing, planning is everything.
I would like to just quickly run you through our logistics cluster prepositioning strategy for 2021. The strategy was launched already in 2019, so it will not be the first time some of you hear about it. But I think it perfectly aligns with what MSF Holland is doing and what Umar highlighted to you. Keeping in mind, this is medical logistics course, which means not all the items can be prepositioned. But as I had a conversation with Umar when he was preparing this presentation for us, he told me that there are several ancillary products that are necessary in hospitals in large amounts and in large volumes. And a very good example is the PPE, personal protective equipment, which rarely even has an expiry date. This is just an overview of different transport modalities that we are looking at. And we just need to keep in mind that it's not only about the cost effectiveness, it's also about being quick in our response. So just as an example, when we use air transport, logistics cluster has several assets such as helicopters. We can only load them with 2.5 metric tons, whereas when we use river transport and we load cargo on a barge, we can fit in 800 or even up to 1,000 metric tons. And obviously road transport is just in the middle, so we have trucks of 40 metric tons, right? So this is just to highlight to you that it's not only about the cost, it's also about the needs, the humanitarian needs, which are super high in South Sudan, as we know. So by using those most effective transport modalities, we can basically engage in a larger scale and deliver the cargo quicker. So this is just a quick overview of some numbers because we want to show also to donors how this prepositioning strategy is evolving in South Sudan. So we can see that in 2020, the logistics cluster transported 47% of cargo by road and river on behalf of the rest of humanitarian community, which is actually 15% more than when we compare it to 2019. So we are very proud of it. That means that the organizations are able to plan ahead and decide on prepositioning of cargo during the dry season and move by road or river. But you can see that also on our graph, which presents some figures. And as you can see, in 2014, when the logistics cluster operation was initiated in South Sudan, we were relying fully on air transport. So this is why the bar is all red. However, going forward, 2018, 19, 2020, you can see a more diverse graph, which means that we are using also road and river more and more. And the most important here is that the cost, which is the line graph, the brown, sort of a brown line that you can see overlying the bars, this actually shows how much money you can save simply by using diverse transport modalities. And we will obviously keep pushing for prepositioning of the cargo during the dry season. And we do understand that we need to engage not only with humanitarian organizations, but also with donors and the wider humanitarian community. Here you can see a map that is access constraints map published by the logistics cluster every Friday. This one is just an example during rainy season. As you can see, most of the roads are not accessible. Yellow means that they're accessible, but with limitations. So usually only for trucks up to 20 metric tons. And red, that means we cannot really move by truck. This is another map that presents the dry season and road accessibility during this time. You can see a lot of roads are opened, especially the western corridor This is actually a very good example and highlights the need for actually acting and doing logistics during the dry season and not waiting until the last minute when the roads are become inaccessible or are accessible, but you cannot use a full capacity truck. This is just to remind you that the logistics cluster has a stock of mobile storage units, just like the one you can see on the picture, which are available to the humanitarian organizations upon request. So these can serve as a storage for humanitarian cargo in deep field locations. And in general, we usually encourage you to first check with other organizations in the same operating in the same area to see if there is a need for common storage, because we give a priority to those organizations who request the MSU and also agree that they would be ready to host the cargo of other organizations that would require storage space. And here is our concept of operations map, which shows different locations where the MSUs have been already deployed by the logistics cluster and they are being managed by partners. And obviously, we are aware of several road rehabilitations, and the WFP is also heavily engaged in making sure that the main supply roads, which are affected by the floods every now and then, that they become rehabilitated. And we usually, during our coordination meetings that happen every 2 weeks on Tuesdays, we usually provide updates to partners because the situation is evolving pretty fast. There are lots of construction projects ongoing, especially now when the roads are dry. So this is why we really encourage you to join our coordination meetings to get this information, but also send us an email just to confirm the status of a given road, because we might just have updated information. And as stressed earlier, we do the same presentation not only to humanitarian organizations, but we are also engaging with other cluster coordinators to ensure that we have aligned message across. And we also highlight the need to donors so that the early funding is made available so that the organizations can procure and secure their pipelines.